If you walk through a densely populated urban center on a hazy morning, the immediate environmental threats to your health are obvious. The standard expectation of public health is straightforward. We identify a risk, pass a law, and the hazard is mitigated. But in Nepal, despite robust legislation on the books, preventable diseases driven by environmental and commercial hazards continue to climb. The persistence of these health crises does not stem from a lack of scientific data. The exact opposite is true. The failure is the result of a deliberate, structural maintenance of ignorance. This mechanism is known as agnotology, the study of culturally or structurally induced doubt. It occurs when industry tactics, regulatory inertia, and selective inattention actively block clear evidence from shaping policy. Identifying exactly how this manufactured doubt operates is critical. Global industries have realized that the unique governance structures of low and middle-income countries offer a highly effective environment to deploy these playbooks, maximizing commercial volume at the direct expense of public health. To understand how this works in practice, we have to look closely at Nepal's specific socio-political and geographic landscape before examining the clinical data. We will map these mechanisms across 4 distinct sectors: agricultural pesticides, tobacco and alcohol, lead exposure, and air pollution. The evidence splits into 2 distinct categories. There is active doubt production, driven directly by industry lobbying, and passive doubt production, where systemic resource failures create blind spots the state simply accepts. A recent critical analysis maps exactly how this dynamic functions in Nepal, detailing how historical underinvestment in surveillance has been weaponized. By deconstructing these 4 sectors, we can move past the vague excuse of a developing nation struggling to modernize and precisely isolate the mechanisms of systemic policy failure. We start with the frontline vulnerability of agricultural labor. Hundreds of thousands of farmers interact directly with toxic chemicals, typically with zero protective equipment. On paper, the state has intervened. The government explicitly prohibits 24 highly hazardous pesticide compounds from entering the country. This chart shows the reported agricultural chemical imports over an 8-year period. Despite the formal bans, total import volume surged from about 400,000 kilograms to 3.5 million kilograms. Within that massive volume are the exact substances the state banned, including highly lethal compounds like aluminum phosphide, methylparathion, and chlorpyrifos. The clinical outcomes are devastating. Pesticide poisoning now accounts for a massive share of rural suicides, with poisoning rates rising 13 to 14% in recent periods, alongside documented links to kidney disease and cancer. How do millions of kilograms of explicitly banned lethal substances bypass a national restriction? The answer lies in the structural vulnerability of Nepal's porous borders. Out of 171 border crossings, only 15 have active quarantine and inspection checkpoints. The state maintains plausible deniability simply by refusing to monitor the entry points. Once inside the country, over 580,000 farming families are left to rely almost entirely on commercial agrovet sellers for chemical training, rather than evidence-based state guidelines. This traces back to the late 20th century, when the state pushed a rapid shift from traditional farming to Green Revolution-style chemical inputs, but completely failed to build the safety and regulatory infrastructure to manage it. This under-monitoring is a textbook case of active agnotology. The structural allowance of illicit trade directly protects industry volume sales, and it does so at the cost of farmer lives. The urban environment reveals a different mechanism of doubt production. Tobacco use remains highly normalized, with nearly a third of the population consuming tobacco. The resulting mortality metric is stark. Approximately 25,000 Nepalis die every year from tobacco-related causes. Again, the legislation exists. The 2011 Tobacco Control Act and subsequent Supreme Court rulings mandate that 90% of tobacco packaging must be covered by pictorial health warnings. Yet, enforcement lags entirely behind the law. Nepal scores moderately high on the Global Tobacco Industry Interference Index, proving documented, persistent infiltration of the policymaking process. The industry actively buys public and political goodwill through corporate social responsibility initiatives,
funding local school donations and purchasing ambulances to mask their core commercial impact. When legislators propose tax hikes on tobacco, industry lobbyists flood the zone with arguments about potential illicit trade and broad economic harm, manufacturing a perfectly balanced policy debate out of thin air. Ignorance here is not maintained by hiding the fact that smoking kills. It is maintained by flooding the regulatory system with commercial noise and philanthropy, creating constant delays in legal enforcement. We also have to examine passive agnotology.
This occurs when known severe health risks are sidelined, not because of aggressive corporate lobbying, but due to chronic under-resourcing and competing national development priorities. Consider the neurodevelopmental harm caused to children by widespread lead exposure, primarily originating from industrial paints and poorly regulated battery processing. Since around 2015, Nepal has had a strict 90 parts per million standard for lead in paint. This chart shows the severe gap between that standard and clinical reality. Blood lead levels in children consistently far exceed safe limits, leading directly to reduced IQ and severe anemia. Because regulatory agencies lack the funding to test products and enforce compliance, the state relies entirely on unverified voluntary phase-out claims from the manufacturers themselves. This passive failure scales up to highly visible environmental crises, most notably the severe particulate matter pollution suffocating the Kathmandu Valley. The primary drivers are clear: dense vehicle traffic, household biomass burning, and unchecked emissions from industrial sites like these brick kilns. Citizens possess a constitutional right to clean air, but implementation gaps and heavily fragmented data collection ensure that aggressive enforcement never actually happens. The long-term disease burden is severe, and the rising threat of climate-sensitive diseases adds layers of scientific uncertainty that completely paralyze underfunded local health departments. In a low-resource setting, you do not need active lobbying to protect toxic industries. Chronic underfunding and passive agnotology do the exact same job for free. These isolated case studies connect to a much broader reality: Nepal's transition toward high rates of non-communicable diseases, built entirely on these structural vulnerabilities. Academics define this overarching problem as epistemic injustice. The actual safety data and the physical experiences generated by rural farmers are structurally marginalized, consistently ignored, or deliberately underfunded by the state. Meanwhile, well-funded industry narratives easily bypass those same barriers, flowing directly into urban policy decisions and creating a massive imbalance of knowledge. This dynamic proves that selective inaction is not a glitch. It functions as a built-in feature of the system, silencing the vulnerable to shield commercial interests. There is pushback. Civil society litigation, intermittent monitoring supported by the World Health Organization, and occasional state bans constantly attempt to fight this tide. But systemic remedies require structural change. The first step is mandating transparent funding disclosures and building a purely independent research infrastructure that does not rely on corporate data. Agricultural policy must shift towards stricter enforcement, with real financial penalties, paired directly with evidence-based chemical training for the farmers actually doing the work. Finally, there is a critical need for public agnotology education, training both the public and policymakers to reliably discern manufactured corporate doubt from genuine scientific uncertainty. Nepal serves as a micro-study, clearly illustrating how global agnotological playbooks adapt to and exploit the porous governance structures of developing nations. Only through rigorous independent scholarship and targeted structural reform can we expose these manufactured shadows and begin to prevent decades of entirely preventable disease.